Hi, good morning, everyone. Uh, we are on 120th session today. We are live every Saturday. We meet uh, all CMAAO sessions, all CMAAO countries we meet over here. We bring a common topic, we bring a speaker, we bring uh, a, a platform where we share knowledge. We all are uh, sharing this platform with everyone, doctors, non-doctors, over the last 120 sessions. And I'm sure a lot of people have got benefited till now. We are seeing a lot of uh, changes in the world. We have seen a lot of news which have been spread over the last few weeks. A lot of places in the world are getting heat wave. We have seen in China, health workers are struggling because the heat waves have almost gone beyond 40 and they still have to wear PPE kits. They're still very strict on COVID rules. In China, the COVID has not been over. The travel is still restricted. You cannot travel in China. All the visas has been expired. They have been, if you really want to travel in China, you'd really need a good reason to travel in China. Similarly, we have seen things going bad in UK. Uh, I was just talking to Dr. Wazi, and there was first polio case again being detected in US in New York, uh, nearly after a decade, and it's been diagnosed in adult, and it seems to be a polio virus. So a lot of things we will bring up. We will in fact bring a speaker who can discuss about all these things. But today we have a country update. We have not had a country update for over the last many weeks because we've been having a speakers for knowledge. So we will start with Dr. Pillai to give an update about India, followed by all other people. Thank you. Dr. Pillai.
Yeah, thank you, Saurabh. India, the situation is that still we have around 21,000 cases per day and almost 40 to 60 deaths happening every day. And number is not increasing, but then it is still simmering around 14 to 21,000. And as is being seen, certain states the number is very high. Other states it is negligible or it is not at all there. Vaccination it has taken a back seat. It's not actively promoted. And as per the studies, it is seen that 4 crores of eligible people have not even got a single or the first dose. But if you look at the whole scenario, 210 crores of vaccine has been given. Now there is no restriction at all. Even mask, it is not compulsory. It is up to you to wear it or not. Travel definitely is no restrictions at all. Even immunization status is not being asked, even for international travel. Schools, education institutions are open as usual, business happening as usual. So now not much importance is given. We are living with COVID with a number of about 21,000. It's little variable, but then the infection is definitely mild. In 1 week, antigen negativity is obtained. It is more like an upper respiratory infection, and not much of medications are being taken, and only those with a high risk and severe comorbidities, the death is happening, and not in other categories of persons. But even in children, there are disturbing news that even in children, post-COVID, multi-organ diseases are persisting. So long COVID issues are there, and youngsters suddenly collapse and die due to thromboembolic phenomenon, particularly in youngsters. So these sort of things do happen. And in these patients, most of the time, the antibody titer is very high and coagulation profile is abnormal. So that is the scenario in India. Thank you.
Dr. Pillai, I wanted to add a news which I was reading yesterday, that the Ministry of India has issued a statement saying that more than 20% of COVID infected cases are having a long-term effects after recovery, even though there was a statement by a renowned health authority that a lot of COVID cases are not having any symptoms. But I think globally, there's a research which has come out which says more than 20% of people experiencing variety of mid and long-term effect after their recovery from their initial illness.
Yeah.
And these symptoms can also include initial fatigue, shortage of breath, and difficulty in breathing, including memory, concentration, and sleep problem.
Yeah.
Persistent
That's
cough,
true.
chest pain, difficulty in speaking, muscle ache, loss of smell, loss of taste, depression, anxiety, and fever. So even including cardiovascular diseases. So this
Yeah.
is like more than 20% is a big number.
Exactly. That is exactly what I was also trying to say, that the post-COVID symptoms do persist in a considerable good number, particularly in the youngsters. So now people feel that you can have one more infection and let it come and go. But that attitude is not correct, because even in children or even young adults, lot of complications of post-COVID symptomatology do persist. So it is always better that you avoid a second or third infection. And basic COVID appropriate behavior still has to be continued. But from the government side, no compulsion, and it is not being monitored. And even in some states, even the statistics are not being taken, or at least it's not in the public domain.
I agree, and in fact, I also know that a lot of people in India have not taken even a single dose of vaccination of COVID.
Yeah. 4 crores people
4 crores,
still
yeah.
have not taken. Eligible people have not
Eligible
taken.
people, right?
Yeah.
So that's a big concern, and I think with this medium, I think we should like we've been traveling, and I think Dr. Wazi, Dr. Russell, they can share their travel experience while they are giving their update. But I think we urge people to go and take the vaccination. This is not something which you should miss, and long-term effects are very high. Long-term regrets will be very high. This is something which all medical associations come together and say that we need to at least have 2 doses of vaccination completed for everyone. Thank you, Dr. Pillai. It was a much needed update from India. Can I invite Dr. Kazi from Pakistan, who is apparently in the US right now? So, Dr. Kazi. Dr. Kazi, can you unmute? Yeah.
Okay. Can you hear me?
Yeah, we can hear you.
Thank you, Saurabh. The Pakistani update, I think there's an increase of COVID cases in Pakistan recently in the last 2 weeks. And the deaths have been between 7 to 10. And the positivity rate, which was well below the 0.6%, is now 3%, meaning that there's an increase of COVID cases in Pakistan. And there are critical care cases who are in the hospitals. So, but there's no, SOPs being followed for the COVID. And the vaccination rate is very low. I mean, despite the fact that PMA and everybody is educating for vaccination, but now people have, started, taking it as normal, and the vaccination rate is quite low. Although the traveling, as I was sharing with you, you need to have, the complete or fully vaccinated, meaning 2 doses of regular vaccines and then the boosters. So I had two boosters as well. So all the four vaccination completed. And then during our flight, we were supposed to wear the mask, keep the SOPs of COVID-19, and sanitizers and all that was available in the flight, except the time when they serve meals or food. Similarly, when we traveled domestically in the US, the SOPs were there, and they strictly asked us to wear masks. And otherwise, there are no wearing of mask in the malls or in the everywhere. I hardly see anybody wearing mask. But there are places. I haven't been to any cinema or a crowded place. Um, People do talk about COVID, but the wearing of mask is not mandatory. It's optional. Some people, very few I saw wearing mask in the mall. Otherwise, people are not wearing it. And the travel requirement is, of course, of the fully vaccinated. People are free to move, and I think we need to, certain that COVID is not over. We may have mild symptoms at the moment with the infections, but things can change very rapidly. And I think people should take it seriously. And although it is said that you have to live with it, yes, definitely we have to live with it, but with some, is being followed throughout that, so that there may not be any dramatic or drastic, increase of COVID-19. So that's all about COVID from me. Thank you, Sura.
Thank you, Dr. Kazi, and I agree with you. Masking is not mandatory, and you will not even find masking in the provincial buildings or these government buildings. Also, it's not mandatory anymore. But yes, as a precaution, people should wear it because the COVID spread is still happening, and your health is in your hand. Can I invite Dr. Russell?
Yeah, it's Australia is having, the Omicron 5. I think there's a outbreak and it's getting worse. I think there's now, I think they've brought mandate of masks in schools. That's what they've done. The hospital admissions have also gone up. I think that's gradually going up, but there's a bit all of cautioning. And they've also brought the fourth vaccine for 30 years for those who are 30 and above. It used to be only for 65. For now, from 30 onwards, they're advising all to have the fourth booster. So I think they reached, they had only reached around 60% of the population at the third, but now they have, and there's sort of big, people are, because of this increasing outbreak, because it's also winter. No, we've been having a very cold winter, unusually cold winter, and floods on one side in the eastern states, and cold in the south. In Melbourne, it's been 1 degree of minus, and so forth. So that has added to the complications. But again, I think those who have been vaccinated are probably, if they did get the infection, they don't seem to have been, unless there was a comorbidity, they are not the ones getting hospitalized. And so uh, that seems to be what we are seeing. But overall, there has been an increase in all the states, including Western Australia. So this is the situation in Australia.
And I believe, Dr. Russell, Australia has asked people to work from home because of this
Yes,
threat, which is
yes. That's what they've advised all to work from home where possible, of course. And again, social distancing. Schools, they've brought the mask to schools. That's where it's brought. But the others, they've been advised but not mandated it. Although the AMA, the medical has been making recommendations, but the government has not doesn't seem to be keen to follow exactly what the AMA. Now, this is a little different from what you might remember how Australia was, particularly Victoria, which became the most lockdown city in the world. But
and
subsequently,
don't forget that Australia is the only country with the maximum vaccination rate also in the last 1 year.
yes, they are over for 8. But the interesting thing to remember is subsequently we had in the Victorian government, they went to Parliament and they removed they had a change and removed the public health requirement to accept the under the public health law to accept the recommendations of the chief uh, medical officer. And so that's why we see now there's very little importance, or at least we don't even hear. Whereas if in the days we had the lockdown, we actually had briefings every day from the chief medical officer and so forth. But now that they are not in the line, they don't come in at all, or they give some advice which is up to the government, up to the health minister to decide whether he wants to. That's been the change from legislation part. So that's another reason we don't, and the government is now not very reluctant to bring any mandated what was done in the past. You see, we ended up being the most locked down city in the world. So I think that they've now become a lot more, for some reason, they refuse to go down the path of mandating anything. Even I see that they've removed, um, uh, we had mandated vaccination for teachers, for nurses, all that's been removed. So those who lost their job have come back now because it's not anymore. Many nurse teachers, for example, had left the job because they were refused to get back. A few of them who refused or didn't want to get vaccinated. Now they've removed that mandate, and so teachers and nurses and others who chose are now legally or eligible to come back. And of course, there's a extreme shortage of workforce because all migration, everything was closed for 2.5 years. So we are having a shortage. Probably the first a 3%, 3 point some unemployment, which has never been in the last. So now you could the workforce problem is acute, and people could ask. And the other thing is that many people also are suddenly looking at quality of life, so they are not willing to work even for more money. They prefer to do only so many days and stay work from home. So this is a problem with the airline. It's affecting all aspects besides the supply chain and so forth. But certainly these are the changes that we see post-COVID now in Australia. So very high, even hospitality. You're talking of that AI is listening. They're talking of $60 an hour to get someone to do a job. Even that type of they're unable to get staff. So that's one of the stories of Australia. Okay, that's
Thank
where
you.
we are.
Thank you, Dr. Russell. Can I invite Dr. Akhtar Hussain from South Africa?
Hi, Sharaf. Good morning, everyone. South Africa last 24 hours, new cases around 300 to 400, and the death rate is very low. In fact, it was the first time yesterday, only one death. Otherwise, whole week within 4 or 5 with the comorbidity patients. And the hospital around South Africa are empty. There are not many admission. Our active cases at the moment is almost 6,000, and recovery rate is 97.3. Vaccination is very poor now. The portals are open, but the vaccination centers are empty. Plus 37 million single dose vaccination so far done. And mask, nobody is wearing, even in the government buildings or shopping center is totally out, and it's no more mandatory. Traveling, same like other country. They don't look at the your COVID-19 PCR test. They only check the vaccination card. There are problem with the second booster dose. People are not coming forward. The government trying their best, but it's not happening. Thank you.
Thank you, Dr. Hussain, for the update. Who else do we have here? Do we have anyone from Japan here? Okay. Can you please introduce yourself? I see. Okay. Do we have any other country present over here right now who wants to speak and give an update? Okay, so I don't think there is any other country to give an update. So I think with this note, we will meet next week again. We will wind up the session early today. With the consent of everyone. Do we agree on that?
Yeah.
Okay, so
Yep,
thank you. Yes, Doctor. So thank you. This was a short update from countries from Medical Association, and we will meet again for 121st session next week. And till then, see you. Thank you for joining in, and everybody take care. Thank you.
Kashmiri apples, Didi, ekdam fresh.
Over 200 fruits and vegetables delivered fresh to your home.